Ladies and gentlemen, it's a great pleasure to be here. First of all, I want to thank the organizers. It's an excellent event, and compliments on that. It's really interesting, and I'm really enjoying the presentations so far. My name is Ciáran Nicholl. I work for the European Commission's Joint Research Centre, and I hope you've seen the presentation this morning by our Director General, Mr. Vladimir Shuka, and he gave a very broad overview of all the activities. Now we're going to bore into one little area related to health data. Now, before I start, and I will be brief because I'm aware about the time, the word prevention was mentioned a few times today. Now, the chronic disease killers are, of course, cardiovascular, cancer, and diabetes. Reality is that 80% of cardiovascular disease can be prevented, over 40% of cancers can be prevented, and over 80% of diabetes can be prevented. Now, I'll give you a little statistic. I'm not going to judge it or place any judgment whatsoever on it, but of all the expenditure in the European Union on disease and on health, only 2.7% goes to prevention. So have a think about that. Okay, let's get going. The GRC is quite new when it comes to health data. So health data, how do I get this thing moving forward? Yeah, health data, you might wonder, why? Why would the GRC get involved, the Joint Research Centre get involved in health information? Well, the Joint Research Centre is ideally placed because it is independent of all national, private, and commercial interests. Basically, what that means is we can put the citizen first. We can put the patient first. That's really important. We exist since 1957. Next year we'll be 60. So we can provide a sustainable platform for continuity because most important health projects take time. Health doesn't happen overnight. Health investments are long-term investments. We also have a proven track record in harmonization and standardization when it comes to data, and it was mentioned several times this morning, accurate data, comparable data. There's no point comparing apples with oranges. We need to compare apples with apples. The accuracy of the data, the comparability of the data, and the coverage of the data. These are very important things. We also have a lot of experience in networking, bringing stakeholders around the table together, sitting with them, trying to get consensus. This is very important. By working together, we are stronger. And finally, we are very close to the EU decision-making policymakers. Okay, now cancer. Well, the reality is 1 in 4 deaths in the European Union are cancer-related. It's a terrible situation. Basically, the cost of a cancer case is between 7,800 euros and 28,000 euros. But yet when it comes to cancer data itself, the data per case, by comparison, is between 3 euro cents and 97 euro cents, which is a small fraction of the overall cost. So it makes a lot of sense to take care of cancer data. Here we're talking about cancer mortality, incidence, survival, and prevalence. So only 4 years ago, the Joint Research Centre got involved. Now we are the custodian or the coordinator of the European Network of Cancer Registries. This is a network of over 155 cancer registries spread throughout the European Union. Basically, the situation was pretty dead. The cancer experts called it a data graveyard. Data were lacking comparability. A lot of work had to be done. The European Network Steering Committee didn't exist anymore, hardly ever met. And if they did, they didn't know what to talk about because there was no funding, etc., etc. So we in the GRC have brought all these stakeholders together. So you have the international agency there, you've got various stakeholders, bringing them together to get consensus. That was the way forward. There's a quick overview of the cancer situation in Europe, cancer data. You will see that you have national cancer registries, you have regional registries. That's all okay, that's fine. I mean, once the data are encoded in a proper way, in a way that's comparable, that's absolutely fine. That's the reality as it is right now. You will see that we have only about 81% coverage of the EU population. Not bad, but could be better, so we're going to improve that too. What have we achieved since then? Well, these are some of the outputs already. We've reinstated the whole network. Now the steering committee, they meet 4 times a year. We have biannual plenaries, very big scientific sessions, where we all get together discussing scientific outputs from cancer data. And we've created a new data submission portal, but in those 3.5, 4 years, I guess our biggest result was that we got all the stakeholders around together to agree on one common set of quality checks. Now, these stakeholders were invariably competing against each other before, competing for funding. They weren't talking to each other, but we as the JRC brought them around the table. We came up with that publication right there in the front, quality checks, and now we've created a software, and we're giving that software free of charge to the cancer registries, so they will start encoding the data of high quality at the source, Now, the purpose is not to collect data. The member states collect the data, but we provide a holistic overview, anonymized data sets pulled together where we can look at trends, etc. There's a little overview of Slovakia in 2012. You will see the estimated incidence for both sexes in 2012. The 33.94, there are over 40 different cancer types here, so they're all bundled together. But the main one is large bowel, breast, lung, including trachea and bronchus. There are some examples. So basically, we're now in a position to start creating fact sheets, showing the reality, showing the unacceptable differences between member states, even within countries, in regions, region to region, from a socioeconomically deprived area to a more affluent area. We're not finished, we're only getting started. Here's my last slide on the cancer work. We're now developing visualization tools so that all the users will be able to go in, click on their country, click on regions, and look to see what's really happening there. Not only that, in the JRC, and Vladimir Shuka mentioned this morning, we have a wealth of data. Health indicators are only one little part. It's a new part. We have environmental indicators, air quality, water quality, soil quality. We have also data on socioeconomic situations, etc. So what we want to do now is, and we designed this in this way from the beginning, we will start overlaying health data with other environmental, for example, indicators. So if there's an air pollution aspect, then you look at lung cancer or lung diseases, for example. That's what we're doing in cancer. So it's only 3.5 years down the line, but we're pretty happy with the way it's going. Now I'm going to move to rare diseases. There are between 6,000 and 8,000 rare diseases which affect between 30 to 35 million people, which is over 6 times the population of Slovakia, similar to Ireland, where I come from. And invariably, these people are left alone with those diseases. Now, the reality is that the information on all those diseases is spread out, fragmented in over 600, we don't even know exactly, over 600 rare disease registries. There is no interoperability between these registries. They are not connected. So basically, the JRC, the European Union, is going to create, we are now starting to create a platform, an interoperability platform for all these rare diseases, bringing the cases together. This platform will be like a knowledge generation center for rare diseases, where the information providers, like the registries, either national, regional, local, hospital, whatever, also the European surveillance networks, they will be involved, and then you'll have the information users. So in essence, basically, it can only bring benefits. Number one, to patients, because it's all about the patients, and they need our support. And like I said, a lot of those people are alone. You know about the orphan drugs, because basically there are no cures out there, and what company would invest if you've only one case here, another case there? But if we start bringing the information together, suddenly numbers will pop up in different countries. This is a typical example of an EU project. And then with a large number, you can start, then you can go to industry and say, what can you do here? So basically for patients, for healthcare and social planning, good clinical practices and good clinical protocols can be developed. Therapies can be developed also. When it comes to healthcare providers, the knowledge development part, the therapy development part, it'll be only benefit, it'll be very interesting for them. So they will also be part of the platform. For policymakers, of course, for health policies, for planning, using evidence to influence policies. And then for researchers, everything we produce in the EU is publicly available. It can be very interesting to tap into that information source, and indeed for the industrial sector, as I've already mentioned. We've already salvaged 2 databases that were about to, let's say, die. One is EuroCat. It's a database on congenital anomalies, which at the end was located in Belfast, but it ran out of funding. We've now migrated that to the JRC, and it's up and running, and we support the network, etc. And now we're presently migrating a database on cerebral palsy, which is located in Grenoble, and we're working on that too. I'm aware of the time. I'm going to keep it short and sweet. Well, I hope sweet. In any case, that's what we're doing in the whole area of health data. We're also working, by the way, in prevention and nutrition and lifestyle. That was also mentioned before, and also we have a project on breast cancer healthcare. I want to end there. I think we're available later for some questions. Thank you for your attention, and catch you later.